Welcome to the Senior Safety Advice Podcast, your trusted source for expert guidance on aging safely and independently. Whether you're a caregiver, a family member, or a senior looking to stay secure at home and beyond, we've got you covered. From fall prevention and home modifications to financial safety and scam awareness, we provide practical tips to help you or your loved ones live with confidence. Tune in and empower yourself with the knowledge you need to navigate the challenges of aging. Let's make safety simple.
Today we're discussing geriatric care. Geriatric care is a specialized field of healthcare focused on addressing the unique needs of older adults. It involves a comprehensive approach to managing the health, the well-being, and the quality of life of elderly individuals. Some key aspects of geriatric care include a holistic approach because it considers not only the physical health of the person, but also the mental, emotional, and social well-being of the individual. Geriatric care is a multidisciplinary care, and this means that care is often provided by a team of professionals that include geriatricians, nurses, social workers, and other specialists of that type. One thing about geriatric care is that it's personalized, so the strategies that they use are tailored to each person's individual needs and preferences. There's also a focus on independence because geriatric care aims to maintain and promote independence in older adults for as long as possible. Another thing geriatric care does is it looks for the management or helps the management of chronic conditions. It gives special attention to managing the multiple chronic health conditions that are common in older adults. For example, arthritis and Parkinson's could be found together in one person, so you want to make sure that you're managing both of those conditions. Geriatric care also is preventative care because it places emphasis on preventing health issues and maintaining the person's overall wellness. And family involvement is a big component because geriatric care works closely with family members and caregivers to ensure the best possible care for the person. Other key aspects include a comprehensive assessment, which includes evaluating daily living activities, mental conditions, and mental factors that may be present. Now I'm talking about anxiety, depression, things like that. It helps to establish a baseline for the patient's overall health and functional status when they have a geriatric assessment. Another thing geriatric care provides is medication management. Now, what I mean by that is it's involved in reducing so many multiple medications. I know people who, they literally have 25 medications that they're taking. And by doing medication management, their total medications, everything that they're taking is they're looked at, and then some medications that may be overlapping or unnecessary are not prescribed any further. So that ensures that the person is taking really what is most appropriate for them at the time. Another thing geriatric care does is it provides for coordinating services across various healthcare settings and providers. So again, they're trying to get all of the doctors that somebody sees all together so that it is easier for the person to not only make appointments and see the doctors, but for the doctors to be able to keep an eye on that person's health between those different disciplines. One other aspect of geriatric care involves advanced care planning. So this is part of discussing and documenting an older adult's preferences for future medical care, including end-of-life care, which is something that a lot of people don't focus on. This can be as simple as, I would like this prayer read at my funeral, or I would like this song played, or something very complex and elaborate all the way up to, where you want to be buried or this kind of thing. What kind of a casket would you like? It's just something that not only helps the person get things in order, but it helps the family when the time comes that the person has passed away. So a geriatric doctor is different from a traditional general doctor because they have specialized training. They're specifically trained to address the complex needs of an older adult. They have expertise in managing multiple chronic conditions, which again are usually common in seniors. And they're focused on taking this comprehensive view that we've been discussing. So they're not considering just the physical symptoms of the person, but again, they're looking into the emotional, mental, and social factors that can go all together and affect well-being. Geriatricians are skilled in managing multiple medications, which helps to reduce the risk associated with polypharmacy or the taking of so many medications like some seniors are doing. They also help to maintain independence and functionality because they are focused on preserving that ability to complete daily activities of living. And these are things like being able to dress yourself, being able to feed yourself and prepare meals, being able to go to the bathroom or take a shower, things that keep you independent and functioning. A geriatric doctor also pays special attention to cognitive concerns such as dementia, depression, delirium, sundowning, this type of thing. So by now you're probably wondering, is there an age, a specific age that you have to be in order to see a geriatric doctor? And there's no hard and fast, specific age on that. But there are things that you should know about seeing a geriatric doctor. For example, most geriatricians typically see people who are 65 years of age or older, but many of these doctors focus on patients that are in their 70s, their 80s, and beyond. So the decision to see a geriatric doctor really depends more on the person's individual health status and their needs, rather than just that they're 67 years old or whatever. You should start considering a geriatric doctor at around age 65, but definitely you should, if you're 75 or older, it probably would be very beneficial for you to see a geriatric doctor. Other reasons to see a geriatric doctor around your 60s would be if you have multiple chronic medical conditions, or you take multiple medications, or you've experienced a functional decline, or you're physically frail. Other things, if you have conditions associated with aging, such as incontinence, dementia, or osteoporosis, a geriatric doctor can help. And another reason would be if you need help coordinating care from multiple healthcare providers. Now, one thing to note too, you can consult with a geriatrician while maintaining your relationship with your current primary care physician, so you don't necessarily have to leave one in favor of the other. Which brings me to, how would you go about finding a good geriatric doctor? Well, there are some key things to think about. You would really like to get referrals from a trusted source. This would be a friend that you know, maybe, or a relative who is seeing a geriatric doctor and could let you know whether they like them or not. You can ask your primary care doctor for recommendations, or other healthcare providers. Maybe you're seeing a physical therapist and you could ask that person for a recommendation. Barring that, if you don't have a way to get a personalized recommendation, you can use a referral tool from an organization like AARP. They usually will have things on their website that you can go and visit, and you can put in the search function, geriatric doctors. A lot of websites will have a directory where you can go and get a referral from somebody about a geriatric doctor. Things that you want to look at when you find a geriatric doctor, when you've been referred to one, is that you want to look at their credentials and their experience. So you do want to be sure that you verify that the doctor's got a board certification in geriatric medicine. It would be helpful to look at the doctor's website and their about page and look at their education, their training, and their years of experience in treating older adults. You also want to do a quick Google search to verify that there are no malpractice claims or disciplinary actions. And then you want to make sure that the doctor is in your insurance network. So depending on, I'm assuming you're going to be on Medicare, but you do want to be sure if you're on like a Medicare Advantage plan, you want to be sure that that doctor that you're looking at is in that plan or that network. You also want to look for obvious things like, do they have an office location that's convenient to you? Do they have a hospital affiliation with a hospital that you prefer? Another thing to think about is while you're doing this research, usually you will find reviews online for the doctor. So you want to pay attention to comments that you read about wait times in the office or staff friendliness, doctor bedside manner. I mean, in my opinion, I'm not so sure that I care about the bedside manner as long as I know that the doctor has a lot of experience and is treating me correctly. But, for some people, bedside manner is something that's very important. You also can look for the online ratings and reviews from other patients who have seen the doctor. And then once you decide you want to maybe see this particular physician, then I would say schedule a consultation, meet with the doctor to see whether it's a good fit to work with them. You can ask them about their experience and what approach they take when caring for their geriatric patients. If you have any specific health concerns, you can address them to the doctor and see what their treatment method or suggestions would be. You can also ask whether they do a comprehensive geriatric evaluation, which can help you determine if you would benefit from specialized geriatric care. So in conclusion, geriatric care plays a vital role in addressing the complex and unique healthcare needs of older adults. As we've been discussing, the specialized field of medicine goes beyond treating individual ailments and embraces a holistic approach that considers the physical, mental, and social well-being. The decision to seek geriatric care shouldn't solely be based on age, but rather should be, focused on individual needs and circumstances. While many people begin to consider geriatric care around the age of 65, it's particularly beneficial for those who are in their 70s and beyond, especially if they're managing multiple chronic conditions or experiencing age-related health challenges. Choosing the right geriatric doctor is a crucial step in ensuring quality care as you age and involves careful consideration of the doctor's qualifications, their experiences, and their approach to patient care. The ideal geriatrician should not only possess the necessary medical expertise, but should also show a commitment to maintaining their patients' independence and quality of life. Ultimately, geriatric care aims to help older adults navigate the complexities of aging with dignity. It provides personalized care that respects individual preferences and promotes overall well-being. Now that you understand the key aspects of geriatric care and you know how to find the right specialist, you and your family can make an informed decision about your health care, which will lead to better outcomes and an improved quality of life in your later years. Thanks so much for tuning in. We'll see you in the next episode. Take care. Bye-bye.
That's it for today's episode of the Senior Safety Advice Podcast, helping you and your loved ones stay safe, independent, and informed. If you found this episode helpful, be sure to subscribe and share it with others who could benefit. For more expert tips and resources, visit seniorsafetyadvice.com. And remember, staying safe starts with staying informed. Until next time, take care and stay safe.